Morning and welcome to this question and answer session on Destination 2 of Cluster 1 of Horizon Europe, living and working in a health-promoting environment. My name is Carmen Laplaza Santos and I am the Head of Unit of Health, Innovations and Ecosystems in DG Research and Innovation. I have the pleasure to moderate this question and answer session today. Let me now introduce the panel of colleagues that will be helping me in addressing your questions on this Destination 2. With me, there is Rita Araujo, Destination Leader, Alex Mulet, mainly responsible for the endocrine disruptors topic, and Orestis Kaliantsidis, who has been co-drafting the topic on occupational health. So Destination 2 is dealing with research on health and environment and health. The main objective of this destination is to fill the knowledge gaps for the understanding of the impacts on our health and well-being of those risk factors that have the most significant or widespread societal impacts. Today, we will be focusing on the topics that will be funded in 2023. 4 topics that you can see in the presentation. First topic, dealing with planetary health. Second topic, dealing with the evidence-based intervention for the promotion on the mental and physical health in changing working environments. A third topic, dealing with the impacts of endocrine disrupting chemicals. And a last topic is a coordination and support action dealing with the global coordination in the exposome research. A total budget over 100 million will be funded in 2023. So we are ready to go on with the question and answer session, but before so, please let me precise that we'll be mainly dealing with content-related questions because there has been an earlier session this morning dealing with cross-cutting horizontal issues, international cooperation. So in case you would have any kind of questions on those issues and you could not attend this morning's session, I invite you to watch at the video. I hope you had the opportunity to watch the videos where we provided more information in detail about those 4 topics. And last, I would please ask you to indicate the code of the topic for which you would like to ask a question before you introduce it. So let's start. I see already 2 questions in the Slido. First question is dealing with the third topic on the endocrine disruptors and is asking whether we can elaborate further on the interaction proposals are expected to develop with the GRC, specifically considering IPChem and the regulatory feedback. For this, I will ask Alex to answer this question. Thanks, Alex.
Thank you, Carmen. Thank you, everyone. So this is a very nice question. Thank you. So what I will say is the Joint Research Center, JRC, of the European Commission manages IPChem, which is this information platform for chemical monitoring data. And this is a database that seeks to bridge the gap between chemical exposure and its impact on health and the planet. So IPChem should be used to store any chemical monitoring data generated by the projects that are selected under this call in order to facilitate access by the scientific community and to have this common repository that can become the main portal for accessing and sharing chemical data in Europe. And the JRC, as I said, is behind this initiative. And as this question also points out, the JRC should be involved with the projects themselves because the JRC acts as a link between the science and regulatory affairs. They can support and advise projects on how best to exploit their results and turn their results into methods, strategies, recommendations, etc., and how to have an impact on the regulatory stage. So JRC should be involved in following these projects, and the exact ways in which this will take place are to be seen after the proposals are approved, as it specifies in the call text. And it is important to emphasize that JRC will not be involved at the proposal stage.
Thank you, Alex. The second question is dealing with the topic on occupational health. I will read the question. Do all the health impacts considered in the proposals need to be related to changes in working environments resulting from the COVID pandemics? Rita, Orestes, who of you would like to take this question?
I think I could take this question, Carmen. Thank you very much, and many thanks to the audience for joining us today. No, I would say that's the short answer. The topic is not limited to the impacts of COVID-19 only. We know that COVID-19 has had its distinct impact, so of course it is an important part of the scope, but it also accelerated other ongoing changes. For example, impacts in the workplace related to the twin transitions, so the digital transition and the green transition, or highlighted the existing problems in workplaces, for example, bad postures with the increased prevalence of home working. So here, an advice would be that there is a common sense approach. Elements that need to be in a proposal from a scientific or from a policy point of view, they should be in the scope. So if COVID-19 is relevant to another theme, then it should feature there, and the proposal should reflect that rationale for including or not including COVID-19 as an aspect. Thank you.
Thank you. Thank you, Orestes. Next question. Again, on the endocrine disruptors topic. So a question for Alex. It is indicated that projects are expected to be acquainted with the activities of PARC. How and at which stage should this be done? Alex?
Yes, so thank you, Carmen. So PARC, for context, is the European Partnership for the Assessment of Risk from Chemicals. And they do work in risk assessment, and they also have vast networks in the research community and in the regulatory community. So from the beginning, once projects begin to produce results, it is expected that PARC will be informed. And what we try to promote is synergies between our projects and this partnership in order to prevent duplication of results and to really streamline efforts in the field of chemical risk assessment. So at the moment, the PARC website is not yet available, but it is expected to launch soon. So we would ask that once the projects are selected, that they go to the PARC website in order to obtain this kind of information. Thank you.
Thank you. Thank you, Alex. Next question on the planetary health topic, but a general question on award criteria. It's asking whether proposals that do not reach all three thresholds on excellence, impact, and implementation will not be considered for funding. And indeed, all proposals need to reach all the thresholds in order to be considered for funding. We can move to the next one, which is a question on the fourth topic, dealing with the global collaboration on the exposome research. This question is for Rita to answer, and is asking whether, Rita, you can elaborate further on how proposals would be expected to facilitate the regulatory use of the exposome data.
Thank you, Carmen. Yes, well, proposals under this coordination and support action are expected to propose options for a governance structure for the human exposome network at the global level. So when considering the different options for this structure, the aspect of facilitating transference of relevant data, methods, and results to the regulatory level should be an important component to be integrated in the proposal. Thank you.
Thank you. Thank you, Rita. Next question is also dealing with the topic of occupational health. Second topic, how should proposals contribute to the new European Bauhaus initiative? How and with whom concretely should they interact? Orestes or Rita?
Yeah, I can take this question. Thank you.
Thank you.
So the new European Bauhaus is an interdisciplinary initiative that combines, among other aspects, the design, the sustainability, and the accessibility to help to deliver the European Green Deal. So in this sense, some of the results from the projects selected under this topic will be relevant to the development of this initiative. Thus, interactions with the new European Bauhaus should not be established at the proposal preparation stage, but instead, after the proposal is approved, the outcomes of the selected research projects that are relevant to this initiative should be communicated, well, ideally via the joint activities to be established through the clustering of projects to the colleagues working on this topic for potential uptake.
Thank you, Rita. I do not see other questions in the Slido, but maybe this has been frozen on my side because, okay, I see that the team is looking for finding a solution. What gives you time to think about other questions to be asked? All right, thanks a lot. So I see next question on the first topic on planetary health. Is it possible to address in the proposal only part of the activities? Sorry, the question disappeared. Is it possible to address in the proposals only part of the activities listed from a perspective of only part of the planetary health components? Rita, this question is for you.
Yes, thank you. This topic is aiming at advancing knowledge in planetary health, considering the links between different factors that contribute to environmental degradation or the health of natural systems and human health. So in this sense, proposals are expected to address planetary health as defined in the text of the proposal. So following widely accepted definitions of planetary health, such as, for example, the one published in the report of the Rockefeller Foundation and the Lancet Commission on Planetary Health. However, we also say in the proposal that projects focusing mainly in environmental and climatic aspects, less studied aspects, like, for example, biodiversity loss or climate change and health, can also be considered. So please keep in mind also that the proposals should address several of the activities listed in the text call. This means that not all the activities mentioned need to be covered by the proposal. I think this answers to the question. Thank you.
Thank you, Rita. Next question, and thanks for all the activity and all the questions that you are asking. So the question is dealing with the occupational health topic and is asking which of them would be, okay, it's on two topics, one on occupational health and on another topic on the destination 4. So it's asking which of those topics would be a better fit for a project using virtual reality for healthcare workers to reduce the burnout. Orestes, do you have the answer to this question?
No, I think, Carmen, I can indeed take this. To be honest, this idea sounds like a better fit for the topic we have in Destination 4 on the resilience of the health workforce. And it might be worth for the potential applicants to also join us in that session or watch the relevant videos to know more about that core topic and compare. I want to be clear that here we are not clearing the admissibility of any proposals in this or the other topic, and of course the potential applicants know much better than this one-line description what they intend to do and what the real challenges are in order to compare between two different topics. The idea is that indeed a better fit is the topic which is more specific to the health workforce. However, one needs to keep in mind that the destination for call topics are focused on the contribution of innovation to health systems and management practices, not simply to developing tools. So my suggestion would be that one reads carefully both call topics and decides what's the most appropriate to submit. A reminder is also that double submissions are not allowed in this case.
Thank you, Orestes, for these very important precisions. So we move to the next question, which is a general question about there was a change. So next question is about widening, and it's about the coordination and support actions for the global coordination of research on the exposome, and it's asking about how much participation of widening and associated countries is expected for this CSA. So for this question, actually, there are no specific figures indicated on how much widening should be or associated countries. I think this could obviously depend on each of the proposals that would be submitted and the concrete context. But it is clear that a broad geographical coverage could be important. So as much as countries participating, obviously, would be better. Let's move to another question, which is also on this topic, and is asking whether we can provide examples of research projects that should be involved in the preparation of this coordination and support action. Rita, maybe you want to mention some of them.
I can take this question. In the development of the Global Human Exposome Network, proposals should take into consideration at the proposal stage or later for synergies after the start of the activities of this CSA, major initiatives contributing with evidence to the understanding of the health impacts of exposures related to living and working external and internal environments. So this might include, for example, the related clusters of projects working on environment and health research, or the partnership on chemical risk assessment, among others. So proposals should identify which should be relevant for the topic of the human exposome.
Thanks a lot, Rita. So there is a question now on the topic of occupational health that is asking whether proposals should focus only on physical health interventions, or do all proposals also need to cover mental health aspects? I don't know who of you would like to answer to this question, Rita or Orestes?
I could take that, Carmen.
Thank you.
No problem. Now, this is a question I think we've received in a couple of different forms, and indeed it's an important one. We do recognize that the call topic is quite broad, so by reading it, applicants should notice that we are aiming for expected outcomes for proposals aiming at most expected outcomes, not all of them, and also covering several of the listed activities in scope. This implies that they have some room to address their real relevant R&I challenges on the topic that they choose, and this of course in line with the scope of the call, and they can omit, for example, dimensions like worker profiles or the dimension of mental or of the physical health when it makes sense for the real challenge that they are addressing. However, I think that they should make this case in their proposal. So explain why this dimension or that dimension is omitted, so that evaluators in the end can assess and grade accordingly why something is covered and why it is not.
Thank you, Orestes. Very clear. Next question is on clustering. very important for us, and in particular for the environment and health portfolio. So our proposal is expected to include a description of potential joint activities to be developed in collaboration with other projects selected under the same call. So at the level of the proposal submission, you are not expected to include a detailed joint activities, obviously because you don't know who will be the other proposals that would be selected for funding. So this is something that will be developed at the time of the grant preparation. But as I said, clustering activities are very important, so it's good that you give a thought or you think about what kind of joint activities could make sense in that concrete topic, so that you can also think about what budget might be necessary. So I think we can move to the next topic, which is again on the occupational health, very successful topic today. And it's asking, can proposals extend to health disorders, for example, back pain? I think, Orestes, you could take this question.
I think that's quite straightforward. If I remember well, musculoskeletal disorders are explicitly referenced in the text, and I think this clearly shows that disorders are in scope. So both diseases and disorders can be covered by potential applicants, yes.
Thank you, Orestes. Next question also on occupational health. Is it acceptable to focus on one type of profession in one work context, or should it be applicable across many work contexts? Do you want to take it as well?
I think I should take it as it's similar to the previous question about physical mental health. Indeed, as long as it makes sense, there are so many working profiles that really obviously one proposal would not be able to cover them all. The focus and the rationale behind it should be clear on why this, and also applicants should really explain in the methodology how they are addressing this profile in a comprehensive way. So if this is covered, we believe that this proposal would also be fully eligible and score well. That always depends on the project idea, of course.
Indeed. Next question is again on the joint activities, networking and joint activities, but it's more focusing on the budget and what sum would be considered as adequate. Rita, maybe you want to take that question to complement my answer. I don't know if you can provide figures on budget, I guess not, but maybe you want to add something.
I can add something, yes. Well, this will depend on the specific joint activities to be developed in the context of the clusters. You can find for guidance a description of the activities developed by the ongoing clusters of projects on environment and health in our website on environment and health research, or the fact sheet on EU-funded environment and health research. Keep in mind that the costs of these activities are to be shared between the projects that are part of a given cluster. So all these aspects are important to consider.
Thank you, Rita. We move to the next question on the very active and lively topic of occupational health. So, considering disaggregated effects for different socioeconomic groups, can you please elaborate further on how this should be applied? I don't know who wants to take this question, either Orestes or Rita.
Well, I can take it also. Proposals under this topic should take into account, whenever relevant, how and to which extent environmental stressors and changes in the working environment can lead to different distributional impacts on human health and well-being. So this includes different impacts on various groups of the population based on a series of socioeconomic characteristics, which include, for example, but are not limited to income, age, and for example, gender as well.
Next question is on planetary health. Is the development of sensors to evaluate the impact of environment degradation in the scope, or are you expecting existing solutions? Rita, this is for you.
Yes. Proposals can build on existing solutions if they are available and they fit the purpose of the proposal, or develop new sensors if the existing array of solution does not fit the needs of the proposal, or if there are aspects that need to be further developed. So both options can be considered and will be under the scope.
Thank you, very clear. Next question is again on the new European Bauhaus initiative, and it's asking, in the context of the occupational health topic, whether you could elaborate, Rita, on what is expected of activities in relation to this initiative.
Well, what can I add more to what I said before? So the expectation under this topic and the interaction with the new Bauhaus initiative is that the results that are relevant to this initiative will be communicated to the link will be established with the colleagues working in this topic after the proposals are selected, and the results that are relevant to this initiative should be then communicated to and linked to the relevant aspects that can include design, sustainability, and accessibility of the new European Bauhaus. So the link should be done after the proposals are approved, after the projects start having results, and the relevant results should be communicated so they can be considered in the initiatives developed under the new European Bauhaus.
Thank you, Rita. I don't see other questions now in the Slido. While waiting to see if more questions pop up, let me thank you already for so much interaction and so many questions. Of course, you can always consult the frequently asked questions in the participant portal, and after the end of this session, you will always have the opportunity to address more questions through the participant portal. I see now a question on the third topic, on the endocrine disruptors. Alex, can you please elaborate on the expected role of SSH partnerships in projects funded and this call? So social and science humanities.
Yes, thank you, Carmen. Yes, so this question refers to a part of the topic text, indeed, indicating that there should be an effective contribution of social sciences and humanity discipline involvement. And the text, in fact, leaves this quite open. The main objective of this contribution from SSH experts and partners is really to produce as meaningful and significant as possible the effects on the societal impact of the research activities that are selected under the topic. So I would direct you to the topic text. It is left quite broad in order to allow for more room in the proposals.
Thank you, Alex. I think we are getting to an end on this session, question and answer session. I would like to thank you for your interest and for your active participation. I would also like to thank you, my colleagues, for their answers. And I invite you to actively follow the participant portal and the frequently asked questions, and to interact with through this portal with us in case you would have additional questions. Let me wish you a lot of success with the preparation of the proposals. Thanks a lot.